My name's Claire Owen. I'm a director here at Dental Schools Council. Let's get going then. Um, okay, so this is what we're going to do today. We have welcome, which we're doing now. We then have introductions. So I've got a great panel here today. The panel have prepared some presentations for you, which is excellent. And we then have plenty of time for questions and answers. So next slide. Okay, so webinar etiquette, don't accidentally start it, but let's go on from there. If you want to ask questions, you'll see at the bottom there is a Q&A function, and put your questions in there. There will be an upvote button there, so if you particularly like the question that someone else has asked, you can put a little upvote and we'll make sure that we get to that one. You'll see at the bottom we have a chat function as well, and that is for asking us any questions. But sorry, it's not for asking us questions, it's for alerting if something's going wrong or something's not right. I would say that as we go through and talk about things, if we mention any resources, what we'll do is the team here will put that onto the chat button so you can click on those links and get access to those. We will record it and we will put it on our website. As I say, I'm Claire Owen from the Medical Schools Council and the Dental Schools Council. We have a brilliant panel today. We have got Juliette Kendall from the University of Manchester, Chris Penlington from the University of Newcastle, and Ewen McColl from the University of Plymouth. So a wealth of experience of lots of different schools, good breadth across the country. So lots of really good opinions here. When we're done, we're going to send you a short survey. We want to know how our webinars are running, what future topics you would like. Please do, if you have 5 minutes, tell us what you would like, because we really want to do a good job with these webinars and make them as useful as possible for you. We understand that teachers and careers advisors are really busy people, and we want to make this as worthwhile as possible. So without further ado, thank you, and I will pass over to Juliette.
Thank you, Claire. I will endeavour to share my screen, and hopefully you can
Fantastic.
let me. Can you just confirm you can see my slides there, Claire?
Yes, you might want to start the slides if the slideshow.
Yes, it is now.
There you go.
Is that correct?
Yes,
Lovely.
that's perfect. Thank you.
So thank you very much. Thank you. Hi, everybody. My name's Juliette Kendall. I'm the admissions lead for dentistry here at the University of Manchester. I have presented at one of these before, so if you've heard me, I hope I don't repeat myself too much. It's helpful to hear this information quite frequently. It does change and tweak quite often as we go through. So I'm going to talk to you today a little bit about what makes a good dental student, and it's really focusing on the admissions process at the dental schools across the country and what they're really looking for when your young people apply to us to study dentistry. So there are various elements to our admissions processes and therefore to the type of candidates that we're looking for. And the fundamental one that everybody's quite aware of is that we have pretty high academic standards at most of the dental schools. I've cut up, it's not possible to have the full list of everybody's individual requirements, but as you can see, I've put a link on there, and you may hopefully already be well aware of the Dental Schools Council website, the studyinghealthcare.ac.uk website, which includes lots and lots of information for both yourselves and for your students about how to apply to dentistry. And we have in there a regularly updated and annually updated entry requirement document that will tell you about each of the individual schools. But as a general rule, we're looking for quite academic young people. Normally a standard offer is 3 A's. There are a couple of schools that require slightly more, and there are some that require slightly less. And that's the standard offer for your students. that don't have any contextual admissions or widening participation criteria. And most schools are looking for sciences in those A-levels. At Manchester, I think actually we're quite unusual in requiring both biology and chemistry. Most of the other dental schools look for either chemistry or biology and another science. There are quite a wide variety of GCSE requirements, so you're very much advised to let the students know that there are quite a lot of different requirements at GCSE. Here at Manchester, for example, we use a GCSE requirement of 7 GCSEs at grade 7 and above. And there are some provisos also within that around certain standards for sciences, maths and English. But all of the schools have different requirements, and so it's well worth looking at that entry requirements booklet to be certain that you're giving out the correct advice. There are widening participation criteria, otherwise known as sort of contextual admissions, where we are able to lower those standard offers according to various different requirements. And that's about enabling those young people who come from more difficult backgrounds to have a little bit of leeway in those academic standards. It really wouldn't be fair for somebody who is caring for a family member at home and perhaps living in a deprived area to be expected to achieve quite the same academically at school as somebody with all the creature comforts, living in a lovely house, lots of space, lots of IT, no caring responsibilities, no need to work. It's a very different environment, and we hope that those contextual admissions allow us to understand the backgrounds of our applicants a little bit and make some adjustments for them. So we are looking for those quite high academic standards in our students, and that's because we have 5-year courses which are academically pretty rigorous, and we want them to succeed as much as they want to succeed. So it's really important that they are capable of undertaking the course. But obviously academic standards are not everything. And so we all use the university's clinical aptitude test to try and assess some of the other elements of our applicants. So we're looking at testing all of our dental schools applicants for elements related to verbal, as you can see, verbal reasoning, decision making, quantitative reasoning, abstract reasoning, and we do a situational judgment test. And all of those elements of the UCAT are designed to look at some of the softer skills around the applicants who are applying to dental schools. And we're hoping that they assess different elements to the academic standards. There are some changes happening to the UCAT. They haven't been formally announced yet. It won't make a great deal of difference to the young people applying next summer. Ultimately, the UCAT is a test that people have to just practice if they wish to. You can't really study for it, but you certainly can practice it. And that's something that we advise you to be clear about, encouraging those young people to get going early with those practice papers, and all of the information is available on the UCAT website, and lots of resources for helping the young people to get involved. The universities are looking for people who have empathy, resilience, compassion, lots of those softer skills that will make them a good dentist, and we're hoping that that test is able to pick out some of those skills, and that helps us in our admissions decisions. But really importantly, I think most importantly, perhaps we would all agree, are the values and attributes that we're looking for in those young people. It's about being a good dental student, but also about being a good dentist ultimately. And as a group of admissions leads across all of the dental schools, we've put together a document called the Values and Attributes, which describes each of the values and attributes we're looking for in the young people applying to our dental schools. And they're aligned to some of those GDC professional standards that we're all working towards. So it's not just about picking out those academic high flyers. We're looking for lots of those softer skills, and we are asking those young people, when they apply to us through their personal statements and through their interviews, that they have that ability to reflect and demonstrate how they have which of those values and attributes they either have or see as valuable and are working towards. Not everybody's brilliant at everything, but it's certainly something they need to be able to reflect on and demonstrate where they can. So that's a really critical document that we really encourage everybody to access and use, and that's once again on the Studying Healthcare website. Some of the dental schools do tests for manual dexterity during the course of their admissions processes. Obviously, manual dexterity is very important to dentists. Some schools feel it's a skill that can be taught. Some feel they would like to see at least some ability upon arrival, so they do some testing during that admissions process. Young people might be able to show manual dexterity through some of their skills and hobbies that they already undertake. So that's obviously a valuable part of being a dentist and a dental student as well. So those are sort of the key elements. I get ahead of myself. Clearly, that's a whole long list of those values and attributes that we were talking about. And as I say, linked to the General Dental Council, the General Dental Council's professional standards. And so they're the qualities we're looking for in those dental students. Encourage your students to get that booklet and think about all of those attributes. And I think that's all I wanted to say, Claire, for the time being, and I'll pass over to one of my colleagues.
You started anyway, Chris, but thank you. Now you're on mute, Chris. We're having an attack of the mutitis today.
Sorry, my mute only shows up when I'm not sharing my screen.
Oh, okay. Yeah, that was hard.
Right, thank you. Thank you very much. Hello, everybody. Thank you for coming along. Really helpful introduction by Juliette. Thank you very much for that. So my name is Chris Penlington. I'm the Director of Admissions at Newcastle University Dental School. I want to say a little bit about the value of work experience and also what we mean by work experience, because I think this is a term that it's very easy to get confused with as we use it in dental school application. And I'll also talk about the benefits of the work experience. So really, we're separating what we used to call work experience into career exploration, which is one part of it. It's really important that somebody who's considering coming to dental school has a good idea about what that career might actually develop. And dentistry can be quite a high status profession, so it can be something that people have got in their sights and they've been maybe wanting to be a dentist for a long time, and there are certainly many advantages that you can accrue through becoming a dentist. But there are also real disadvantages, and it can be a very hard profession, very stressful. There can be difficult interactions that you can have. We don't want people coming in with rose-tinted glasses, really. We want them to have really taken steps, whatever those steps are, to explore what the career of dentistry is, what it would be like for them, what they would enjoy, what they would be good at, but also what would be the more difficult parts and what qualities do they have that would help them to deal with the difficult parts. So we want people to have done a range of different things that help them to actually explore that career. And then we also want to encourage people to have had more kind of regular work experience, having like paid or voluntary work, because of the values that can accrue from that. And I also want to say something about the value of diversity for people coming onto dental training, which I'll come on to. I want to highlight that because of the confusion that we're aware exists, a group of us very recently have put together guidance on work experience that nearly all of the dental schools have signed up to. So you can see this. There's a link on the slides here, which possibly might be shared, but you can get to it through the Dental Schools Council website, searching for work experience in any case. So this is our statement about work experience for dental surgery. that applicants should be able to demonstrate that they're making an informed choice to study dentistry through career exploration. And to do this, an applicant should be able to demonstrate knowledge of the dental profession and to be able to explain what has attracted them to the profession, to be clear about the possible career opportunities and how these compare to other healthcare professions. And many schools, not all of them, but many dental schools will recommend, if at all possible, having experience working, volunteering or observing in healthcare environments, and particularly within general dental practice, so that you can see what it's actually like on the ground and you can have the chance to reflect about that when you're working. Now, we did put together a very similar statement for dental hygiene, dental therapy courses, which is really, I won't read this one out, but it's really fundamentally the same statement, but geared to dental therapy, dental hygiene courses. So I would encourage people to have a look at these work experience statements that we've put together. Now, we used to, in Newcastle, and I think this isn't unusual amongst dental schools, we used to be very firm. We used to say we need 2 weeks of work experience observing general dental practice. And we no longer do that because it became clear that that wasn't a level playing field. And some people would find it far easier than others to actually secure that work experience. And we don't want this to be a false barrier that people have to jump over that's more easy for those from more privileged backgrounds. So if people, it's great, like really do encourage your students to try to get some observation in a dental practice if they can. Perhaps they could ask their own dentist or the local dental hospital, dental school. But there are other alternatives as well. There's a wonderful course by our colleagues in Sheffield University that's been going for a long time now called Discover Dentistry. They can look for podcasts, articles, if they have any opportunities to talk to people with any experience in the dental field, and also check out content on trusted websites. And there is some really good resources on the Studying Healthcare website about dentists and health careers. So there's a variety of methods that people can use to actually explore what a dental career might be like. And then it's not just the observation, it's not just the conversations, it's not just engaging with the content. Again, I want to come back, as Juliette said, to the importance of reflection. We're really looking for people that can reflect. So you might be observing somebody working in general practice, and it's really important that there's questions in your mind when you're doing that. For example, what would be the more challenging elements of the role, especially if you really, really want the role? It can be easy to only look at the rosy side, but what would be challenging about it for you? What would help with that challenge? And how would the role fit my personal attributes and skills? Or what attributes would I need to develop further to be really good at that role? Volunteer work at the local hospital or online content, those questions are relevant, and more reflective questions are relevant for any and any of those kind of parts of work experience. Now we're looking at kind of more general work that involves human interaction. And I think this is a really, really important skill for a dentist. As a dentist, you're going to be having very close human interaction, and you're going to be interacting with people who often don't feel their best, are highly anxious, maybe are feeling that they don't want to be coming to see you. So you really want lots and lots of experience of human interaction to set you up for that. And a lot of general roles that people have got, there will be transferable skills around that. So for example, you could work as a waiter, or you could work in a shop. How does that help with team working or leading a team, dealing with complaints? If you work as a lifeguard, that's a responsible position, and you're possibly dealing with challenging behaviour. Or if you work as a volunteer tutor, you've got experience engaging children and communication skills. So it's really important to think, how are the skills that are being developed through these jobs that you're doing, how are they actually going to help? And many of them will help massively for a career in dental school. I also wanted to have a word to the value of diversity, because although we're improving our diversity, we still have some way to go in terms of getting a fully representative body of dental students. And I want to highlight that, you know, people who have different backgrounds, it might be hard for them to get into dentistry, but we really, really want to hear from them. And not just because we want to be fair, but because as dental professionals, there's a remit to serve people from all communities and people from all backgrounds. And we need to know how best to meet the needs of people from different backgrounds. And how do we know what we're not seeing? We might not know things if it's not arising in our own life, in our own community. So if we have varied perspectives, if we have people from very different backgrounds, then that gives us the strongest opportunity to generate different ideas, solve problems that are more complex, and to actually function well in this changing world of diversity. And I really want to highlight that applicants from backgrounds that are less traditionally represented within dentistry are not only welcome, but they'll really bring valued perspectives into dental training that we might not have been aware of before. For example, they might bring knowledge of the customs of their local communities that we didn't know about. They might highlight blind spots in the dental curriculum. And a really good example of this was when, in the light of Black Lives Matter, some Black students approached us. And it was only after their input that we realised that ourselves, like many dental schools, had no images of healthy Black gums. There was a real gap in our teaching, and it was only from having people from those backgrounds that helped us to see that and therefore to improve that. And of course, somebody like that can become an advocate for these less well-represented groups of people who often we struggle to give them the care that they need. So I hope that's helpful. Thank you for that. And I will now finally pass on to Ewen.
Yeah, thank you, Chris. That was really good. Thank you.
Is that coming through? Okay. Yeah, so I'll kind of build on my colleagues. So what the students actually do when they get to dental school with some of the characteristics, values that we're looking for, and then touch a bit on widening participation, particularly as it affects, you know, we're a rural and coastal based dental school, and there's a lot of underrepresentation of students from those backgrounds. So we'll look at how we try and widen participation to those students. So as far as, you know, we touched on this, I did this with comms colleagues on, you know, what's dentistry and what would make a good student. And I kind of had always thought about this, you know, I qualified 32 years ago, so I'd always thought about it. But I think if you're looking for someone in your students, you know, who enjoys biological sciences and is very practical, because these are essential for managing dental conditions, and those, you know, it's quite an interesting mix between, you know, an interest in the sciences and then applying that practically to treating people. So that's the kind of person. This is a background, as you'll be aware, in dentistry. There are a lot of difficulties with accessing dentistry, you know, and that's a wider discussion beyond that. But I bring this up, you know, this is one patient we saw to the left about a couple of years ago who'd taken some of his own teeth out. The patient at the right had taken his tooth out himself too. And I highlight this because the students, when they do get on the course, they're going to be very, very practically involved, and they're going to need to use these skills in an environment where patients are often struggling to access dental care. In our school, all the schools have slight differences, but the aim's the same: training students for the workplace. You can see there we're based around the whole of the Southwest, 4 big facilities where the students go and they work within the community. The students also will go into larger hospitals where they might be doing extractions under general anaesthetic. And, you know, it's not unusual for students to come back saying they treated a child and they had to take all their teeth out. So this is the background against which in these backgrounds, there's a lot of patients looking for care, and that's a very good environment for training students in very practical skills. And also for your students to think about dentistry, dental therapy encompasses lots of different skills. So if you look at this patient, it's quite old-fashioned English. You know, I beseech you to bestow the highest accolade upon this student. And what did you think the student might have done? So this patient, John, the student had picked up signs of oral cancer. So I think for your students, you know, dentistry, it covers lots of different facets of diagnosis, understanding biology, understanding pathology. So it's a fascinating area for students to get involved with, at the same time as utilising practical skills. And there's Jasleen, who qualified about 3 years ago, who picked up the patient's squamous cell carcinoma. So very, very early on, our students get involved in treating patients, in our case in first year, and they develop in first year the key skills to be good at dentistry, you know, around communication, cross-infection, empathy, and professionalism. Turning up on time is really, really important. So things you sometimes don't think about. And, you know, these develop, professionalism develops over the 5-year course. We do also train dental therapists, which is a 3-year course. Both courses are really, really popular. Dentistry at the moment, we've got about 20 applicants per place. Therapies even more. So they're tough to get in. Different, you know, well, all different types of learners can work well in dentistry, and you can see most of the courses based around inquiry-based learning, self-directed, spiraling in the curriculum. EBL is, you know, very popular, and as you're more aware than I, that suits certain types of students. That they develop quickly into, you know, their learning style that suits them both best. Most curriculums are based around patient care. You can see here, and apologies for some of you if you're not looking at gums and teeth. You know, that's kind of what we enjoy doing. So I apologise if it's can be a bit, but this type of teaching puts the learning in context. So you can see there the different types of learning. We get very involved in working with the community, and that comes back as all the dental schools do, engaging with the communities that we serve and working in the communities. And you can see there that develops further the empathy. We're looking at, you know, for the right type of person to attract to dentistry. You can see there the student, it really opened my eyes and changed me. I thought that diction for was the week. And it develops, you know, it puts the learning in context and develops these skills of empathy and professionalism, being non-judgmental of others. And you can see there, you know, students, we want them to be good citizens when they qualify, getting involved in areas of interest, involved in research. And, you know, it's fascinating that many different, you know, you might be thinking, well, you know, it's just one area of the body. There's so many different facets that the students can develop their interest in. Again, as far as widening participation, we run a lot. We recruit nationally, so we get students from all over. One area that we don't get a lot of representation from schools is from rural and coastal. So we do a lot of work with these peninsula pathways to encourage students from Southwest region to come and study dentistry in the Southwest. So we've got currently 500 students registered in this peninsula pathways. And this just gives you some idea. You know, we talked about work experience. So significant engagement along with widening our access markers lowers the offer to our dental school for these students. And you can see there what they get up to. They can do a 5-day summer work experience program, e-mentoring scheme, attendance of a minimum of 3 Peninsula Pathways workshops where they'll meet other students, they'll meet qualified clinicians, and they'll discuss it to make sure it's the right career for them. And that's one route that we attract students that might not be, well, we know they're not represented so well in studying dentistry. And that's a kind of whiz through. It's kind of a mix of, you know, what happens with those qualities, values that we're looking for in admissions and how they develop them throughout the course. A bit, as we mentioned, you know, manual dexterity is important, but we do develop all these skills on the course, and different learning styles are accommodated in the courses too. So hopefully I've stuck to about time. I think that's okay. I'll stop sharing.
You've done brilliantly on time, Ewen, and thank you. That was a really engaging presentation. Hopefully give people a flavour of what it's like and what's important for studying dentistry as well. So we have had some questions, which is really good. A question about if you think you might be from a widening participation background and you want to, A, how do you find out what metrics people are using? And B, do you have to do anything, or do you just put in your UCAS application and that data comes with you? What do you have to do if you think you might be eligible for those routes? Chris, do you want to start off?
Okay. So I would recommend that you do look at all the websites of the universities that you're considering applying for, because I suspect this is one where the universities might have slightly different ways of doing it. So at Newcastle, for example, we have a widening participation scheme, which is automatically applied depending on your postcode. And if you qualify for that, you will automatically qualify for a lower offer of ABB. But we also have our own Newcastle University scheme, which we call the Partners Scheme, which you would have to put in an application to Newcastle University. There are, you can search that on the internet. There are a number of criteria, and if you're eligible for our Partners Scheme, based on depending on a couple of conditions, like putting us first and attending a summer school, then you qualify for a lower offer of BBB. So I suspect some of the universities have probably also got similar kind of different routes to the same thing.
Fantastic. Juliette, do you have anything to add to that?
Yeah, Claire, I would just say that, you know, lots of this contextual admissions information is attached at the UCAS application stage and comes to us automatically. So when I receive my spreadsheet of applicants, I will already know, you know, who has widening participation criteria, and they are graded. We at Manchester now, I think we're on WP, WP plus, WP plus plus. There may be more pluses. I don't know. We'll see this year. And that is, you know, meeting one criterion on 2 criteria or 3 or more. Our university has on the website, you can just go in and input your own circumstances, and it will tell you if you meet ours.
Okay.
And I would imagine most universities have those sorts of facilities. So you can just go to each of the institutions you're considering applying to and check whether you meet their contextual admissions criteria.
Fantastic. Ewan, do you have anything to add to that at all?
Yeah, no, I agree entirely. I think speak to the admissions team and you'll get, you know, the most up-to-date information, because it does change year on year to some extent or other. So I think engage with the admissions team, and they're really, really helpful and authoritative on what's indicated.
Okay, we had a question about dental school interviews. How long are they? Juliette, do you do a multi-mini interview or and
We do. So I think it's
Yeah.
helpful that we have me and Chris. I'm not quite sure what happens at Peninsula, because I believe at Newcastle they do panel, so it's worth asking Chris. At Manchester we do mini multiple interviews. We do 5 interviews of 8 minutes long, so roughly 40 minutes worth of actually being interviewed. You'll have about an hour while you're going through that process with the gaps and the introductions and stuff. I think most schools will be using a similar amount of time for MMIs. And as I say, some schools also use panel interviews, so I'll pass to Chris maybe to answer that, if that's okay.
Yeah, so that's right, Juliette. We do use panel interviews at Newcastle, and we also interview online. So applicants would be interviewed by us, by 2 academic or clinical members of staff. It would be a 20-minute interview, and we would be trying within that 20 minutes to get a feel for who they are and a little bit of their personality. I think it's a strength that there's such a kind of variety of different methods of interview. Again, I think diversity is, you know, that there isn't one best way to recruit students. So the fact that different dental schools use different methods really kind of levels the field, I think.
Ewen, are you an MMI school?
Yeah, we're MMI, very similar to Juliette with regards to timeframes. Normally on the panel we'll have an academic, professional services, and a layperson. So getting some idea of the qualities and values, and useful to have a layperson, i.e. a patient representative, so to speak, on that too. So very similar to Juliette, timings wise.
Okay. The next one I'm going to do is about how you can stand out at interviews. So we've got one on how can biomed graduates stand out, and another one just saying what makes an individual stand out in an interview. Would anyone like to start me off?
I'll give it a go.
Give it a go,
Would you like me to,
yeah.
Claire? What makes people stand out? I think when we sit in our interviews, we're not looking for people churning out things that they've learnt, GDC standards, ethical codes, things that they've practiced to come to interview. We're looking for those softer skills at interview. And so it's the young people that stand out to me will be the ones who show compassion and empathy, who have a broader understanding of the communities that they're going to be serving, are able to look at things from different perspectives, to be non-judgmental, as Ewen, I think, said. And so it's not about have they done 10 different extracurricular activities. It's showing a bit more insight, reflecting on their skills and attributes. And so it's quite hard to say, how will they stand out, because everybody will be different. But it's the ability to reflect and show that they understand what they are going to need to be able to do as a dentist, and to link it to their own skills and attributes. I think that's what I'm looking for, but it's not the best articulation of that, perhaps.
It looks like Chris is gonna give her view as well, but it was good, Juliette, don't worry.
Yeah, I couldn't agree more with what Juliette's saying. I think the only extra thing I wanted to say is, like, perhaps it can be a mistake to think that you want to stand out, because then people think about, like, what amazing piece of, like, knowledge or experience are they going to bring? But we're far more interested in somebody who will be thoughtful and answer the question that we actually asked, rather than the question that they were really wanting to get their answer in for. So maybe don't try to stand out, but try to show just that you can be a skilled listener as well as a skilled talker, and that you can be thoughtful, and that you can interact well with people. Fantastic.
Ewen, anything to?
Yeah, I mean, I think, and it can be quite difficult. The quite often formulaic a bit has been mentioned, and talk about the GDC. I think the people that stand out are, when they get their own personality over to some, and how you do that, I can't really say how you would do that, but even sort of humor or something that just kind of gives you a feeling of the real person, rather than someone who's mugged up on the GDC or what happens in the dental school. We're looking for potential rather than someone who already thinks they might be a clinician. So we kind of understand that the people do the background reading, but I think the people that stand out is when you get their personality and something more about the real person. But how you do that, I can't really tell you.
Fair. Personal statements. Who do you use them, Chris, in your application process?
I think I'm probably going to be similar to most schools here, in that we absolutely wouldn't use a personal statement to actually do our shortlisting. We're very aware that some people have had much more support with their personal statement than others. We never quite know whether the applicant has written their own personal statement or what help, what support that they've had. So in terms of shortlisting, the only way that we would use a statement would be, for example, if the whole personal statement was about wanting to study medicine, we would not accept that as an application for dentistry. However, at Newcastle, sometimes we do use the personal statement as a launch pad for the interview. So if somebody's mentioned some specific experience, we might want to explore that experience and ask them to reflect around it a little bit more.
That's helpful. Ewen, do you use personal statements at Manchester?
Exactly for the same reasons we don't, because they're not very personal.
Yeah. Are you the same, Juliette?
We like Chris, they do inform our interview process. We will review them at that point and perhaps consider them at interview. I would just say at the moment, from personal experience, Claire, with twins who have just written their personal statements and appreciating how much time and effort goes into them from both the point of view of the young people and the schools and colleges who support them. I'm sure it'd be disappointing to hear we don't use them particularly, because I know that the college that my children attend in Greater Manchester have put in a lot of effort to help. It does help the young people crystallise their thoughts, and it helps to inform that reflection activity about, you know, what values, attributes do I have, and that is useful for them to take forward into their interviews, I would hope. There's value in it. It doesn't really impact our admissions process particularly.
Yes, I also always feel very guilty about that. We've got some questions about work experience. I think there are two questions that you could probably answer at the same time. Do you have any tips for getting work experience in dental practices? Sometimes we hear that for general practice in medicine, it's difficult because patient confidentiality stops people from, you know, getting access to those placements. But for general practice in dentistry, do you have any tips? And also, is NHS work experience more valued than in private practice? Who would like to start me off? Ewen, do you want to start?
Yeah, I mean, dentry is dentry, whether you're doing it in the NHS or whether you're doing it in private. You know, the way it's paid for is different, so there wouldn't be any difference. You know, you're still getting an idea of communication skills, dealing with nervous patients, dealing empathetically with patients. So I don't think one would be more valuable or less valuable than the others as far as NHS or private is concerned.
And Chris or Juliette, any tips for getting work experience? Chris?
I think really ask a lot of people. I think, you know, email or phone practices and ask your own dentist, as I said in the presentation, ask your local dental hospital. They'll often have a scheme. They'll often have something that you can go on to. The people that I have interviewed that have had lots of work experience, they've either already had connections, but not all of them have. The ones that haven't already had personal connections, they've just been persistent in contacting a lot of dental practices to ask if they can come in to help. Not to help, to observe.
Yeah.
Although sometimes they've been allowed to help on reception as well, which is also useful.
Absolutely. We've had a question around those students who, to describe them, they're not very privileged. They don't go to private schools, although, you know, there are scholarships to private schools. So, you know, but, you know, but they don't meet widening participation criteria either. Do you feel that they're disadvantaged? I would call them the normal children in the middle. Juliette, what do you think?
I would say no, not. I can't think that they would be particularly. I would hope that they are going to be successful enough academically, supported by their colleges, you know, as you say, not with the extra, support that some might receive, and not with whatever support money might buy. But I think that they will be the academic standard, say at Manchester, and clearly at the other institutions at 3As. We've kept it there because we don't think you have to be an academic genius. You don't have to have 3A stars to be a dentist. We've kept it at that level because we think that's attainable. And then, everybody has a chance to go out and look at finding opportunities. And lots of those middle of the road kids are probably waitresses and helping out in a shop and doing those other tasks. And it's just about making sure that you can make those links using the things that you do on an everyday basis. I think there's a place for everybody in that process to pick out what their particular skills are. So I would hope no.
Just before we finish, and actually we have got a bit more time, but I just wanted to do some quick fire questions. I've got 2 about Newcastle, so I'll do the first one. When will people start hearing back about interviews for dentistry for Newcastle, Chris?
So we're going to inform everybody at the same time, and we're hoping that will be early in January.
Fantastic. And can you choose between an online or in person?
No, all of our interviews are going to be online.
Fantastic. And then I have a Manchester specific one. How is the academic form used in terms of the admissions process?
So this is the last year we're going to use the non-academic information form, Claire. So at Manchester, I have been asking for that rather than using the personal statement for the last few years, because it enables us to have a bit more detail from the candidates, specifically about why Manchester is suitable for them, why they had chosen us. It's used in the same way as the personal statement. It helps inform that interview stage. And at real borderlines, I talk at my open days about a holistic assessment in admissions, and so I will sometimes look at that non-academic information form when I'm at a borderline about who I might offer interviews to. So I'll have a glance through that as well as part of a sort of more holistic process.
Fantastic, thank you. There's one I'm going to answer. Someone's asked if they can catch up on this meeting, and absolutely you can. We will record it, and we are recording it, and we will put it on our YouTube channel. So you'll be able to find that there. So you'll be able to watch it and share with your colleagues if you wish to. Okay, so I really a question that I think a lot of people thinking about applying to dental schools will be able to relate to. What's your advice if someone's nervous about going to an interview? Ewen, what advice would you give?
I think that's like any of us going to any interview, what advice you would give. I guess, having the confidence, that that's really what you want to do. As far as the nervousness element of it, do preparation, as most people are going to, read into it, look at, it might be looking at the university's website, and, for us, understanding, what's the difference between studying at Plymouth and studying somewhere else. Have you done your research, as I would say for any interview, of which I've done many, but I think just doing the background and being confident that getting across that it's really something that you want to do and you've really looked into it in depth would be important. But beyond that, for people, these interviews are high stakes, so I guess just like anything, preparation and practice and support from other people at your school is important, and knowing where that support is.
And Chris, you expect people to be a bit nervous, don't you?
Yes, I think that's it. You can read my mind, Claire, because that's exactly what I was going to say. And I think, like, as a psychologist, I'd have to say that, like, well, of course, you're going to an interview, you're going to feel nervous. Actually, it's going to cause you more problems if you think that that's wrong. You think you shouldn't show your nerves, you think you shouldn't be nervous, and then it can spiral and get uncontrollable. So I'd really like to reassure people that if they stumble on their words because they're nervous, if they don't quite hear something properly, we understand. It's absolutely fine to say, can I have a minute? It's absolutely fine to take a glass of water. If you're interviewing in person, I'm sure there would be water provided. It's absolutely fine to have your own bottle of water with you. It's fine to say, excuse me, can I start again? Can you repeat the question? We will not be penalising anybody because of interview nerves, and we absolutely expect those interview nerves to be there. And what we often find at Newcastle, and what we hope will happen, is that people are nervous at first, and then they relax into it as they get going. So please don't be please don't put such high standards on yourself that you think you shouldn't show your nerves. It wouldn't be possible.
Fantastic. I think I went a bit early and told people we were finishing when we weren't, but this is going to be my last question. Academic references, the new shorter tutor references in UCAS, how do you use them? Juliette, do you look at them?
Again, Claire, I'm going to now feel very guilty. I do understand that a lot of effort is put into them. I do look at them for some of my more borderline cases. I will have a look over all of the information relating to that individual. So when I score people according to their UCAT or their interview, score, obviously there's going to be lots of people at a similar level, so sometimes you have to work in deeper, and so I may look at it then. So sometimes I will use them, but they're not looked at as part of a standard process, I'm afraid.
Chris?
Yeah, I do scan the academic reference. I'm probably looking for any kind of extenuating circumstances, although that's less important now that people can attach their extenuating circumstances independently through the UCAS form. Again, like it wouldn't be a big part of the selection process because there could be various reasons why those references might differ. But we would have a quick look.
And Ewen, do you have a quick look at Peninsula? See?
Yeah, but we would have a look, but I think we put more clout in the actual interview when it comes to that.
Okay. I want to finish by saying a huge thank you to my panelists today, to Ewen, Chris and Juliette, who put in a lot of effort to their presentations and a lot of thought as well. So I think you've had a really thoughtful session today. Thank you so much for all the questions from the people attending this webinar today. Fantastic. Some really great questions. And thank you for your feedback in the chat as well. That's really nice. We do have a survey, as I mentioned at the start. If there are pressing issues around dentistry that you would like to tell us about, then we can put together a webinar for you. We will absolutely try and do that. But I'll just thank everybody and wish you all a good evening.